every doctor, every psychiatrist. But we also agree that some psychiatrists have specialized in medical psychotherapy. That those who specialize in medical psychotherapy spend the greater part of their clinical life practicing it. But we also agree that even those who are involved in other subspecialties should have more than just an understanding of psychotherapy. It should be more than just understanding. Because in some countries, in the general medical students are expected to have an understanding of psychotherapy. They are expected to, by example, a doctor, general practitioner. That's when you leave medical school, they are expected to be able to do simple, supportive psychotherapy. It's not just having an understanding. Every practicing doctor is expected to do that. The WHO now allows non-doctors and almost every person to be able to administer psychological first aid to others. So if we are psychiatrists, we need to have far more than general understanding. We need to be a little, just understanding, being psychologically aware cannot be adequate for a psychiatrist. We need to go a little further. So, in this session today, we are going to start it all off again. Some 8 years ago, the Able Group and a few others, we tried to bring to the fore sessions of psychotherapy like we're doing now. But what we plan to do at the end of this is we're going to give a phone number, a WhatsApp number, and an email that psychiatrists who are interested would, should I say, send their names. We are updating that list. The idea of updating this list is so that when we have opportunities and for self-training, and if we are lucky, as we are really planning to get other psychiatrists from diaspora or from anywhere who can help support and build up the skills we do that. Because it will be so sad for you to see a patient who really needs it and you don't even know what to do, you don't know how to start. Someone is crying in their arms and you just don't have the skills except to say, okay, I'm sorry about it. Psychiatrists ought to do anything more than that. So to get us fully aware again, we are starting with a few sessions, and the first person is already standing. Professor Ohaeri is able to talk to us on certain aspects which have been revisited. And it's interesting because Jude and Professor Raki and a few other psychiatrists years ago had collaborated intensely with some psychologists from Professor Udofia and a few others, and I think started Nigerian Psychological Association, Nigerian Psychotherapy Association. And we are hoping that when we start again, we'll be able to get that function so that we can train together. We can't do all the psychotherapy in Nigeria. So we need the psychotherapists, so we need psychologists who are equally trained to participate. Unlike them, they think that psychotherapy is exclusively for them. They know better, most of them know better. Psychiatrists are also honors of psychotherapy. Many of us still remember the follow of psychotherapy actually. So, gentlemen and ladies, Professor Jude,
thank you very much. Please note that I practice psychotherapy again. He was talking beyond the time he has given me to talk, and I allowed him to talk so that he's happy. The psychotherapy makes people to be happy. You allow them to avoid themselves. Thank you. And I'm back on the so you are first, the local organizing committee spearheaded by Peter for making it possible for me to be here. Second, my very dear friend, Thank here. You know, he is really wonderful to me. Thank you. He inspired this lecture. The third person I will acknowledge are those who have chosen some artwork in this presentation. I can only do the sketch on paper, but my two patients on admission in my facility, I'm not mentioning their names, but there are two very brilliant young men, as you can see. They didn't use any apps to draw this diagram, which I'm going to see soon now. So thank you very much. My topic is on this, the idea of neglecting, understanding the structure and functioning of the mind. And this neglect is already alluded to by the Nobel laureate in psychiatry, Eric Kandel, who noted that psychoanalysis has been very neglected in modern times. Whereas psychoanalysis actually represents the most coherent and intellectually satisfying view of the mind. That's a very important statement. He made this statement in two seminal papers that he published in American Journal of Psychiatry, 1998-1999. I would wish that anybody who is interested in psychotherapy, in fact, all psychiatrists, those two papers are highly likely. And the second point he made was that psychiatry has to find this routine in biology, brain biology, which he said in America that is currently not available in medical programs even in America. And this is echoing Sigmund Freud. Sigmund Freud noted that we must recollect that all of our provisional ideas in psychology will presumably one day be based on organic structure. He continues to make statements on this. He actually drew a diagram in the cognitive technique of psychiatry. I see that diagram anymore, in which he gave an idea. Nobody understood that diagram. I don't know whether you saw that diagram from the window. That's a front diagram of the mind, very complicated. So that's where I'm taking off from. So today, I'm going to emphasize that my main point is on the clinical psychology. But then there are three main parts to this lecture. The first one is to introduce you once again to refresh your mind about the Freudian conception of the structural and the topographical models. Then, number two, I'll veer into what is the body of this lecture, which is an advancement on that more simplistic version by Freud that will build up, especially people with a biological conception, especially Ken Weber in the book Transformations of Consciousness. Very important book. So from there, I will explain his understanding and correct understanding of the psychic structures of bodies and how it operates. Then finally, I will end up with what I think was what Freud was thinking about. In other words, what I call the dream of Freud. I have always been inspired by that since I entered psychiatry. How do we come to understand what Freud was thinking about? And I think I found an answer. And I'm very glad to share it with you at the end of this program, at the end of this lecture. So the importance of knowing the psychic structure is to say, would anybody practice surgery if they did not know about anatomy in detail? Let's say you are doing neurosurgery and you didn't know the details of the structure and the anatomy. Will you practice medicine if you didn't know physiology? And so on and so forth. And yet, we are practicing psychiatry as if, it's not important to know about the structure of the mind, which is what we are dealing with. So, after I've reduced this slide, it was 30-something or so. We reduced it now to get here. This is what you know already, the topographical model, and I think this is the one we use now. Now, where do you want it? I want the red. Who are the people? Thank you. Okay, I can't. Okay, so I have the the structure of the mind. You have the structural model, but I had the topographical model. Can you give me that? Okay, that's the topographical model. That is the conscious and the unconscious. And this is a full diagram to help you. The idea that so you have the conscious, the unconscious, and the conscious. And then you have the structural model where you have where is this word? It's not sure. Okay. Where you can see the one that's white, that's the conscious. The only structures that are there are the ego and the superego. And that's the question we're asking in the exam if I said it. That the id, super, and id, ego, and so on cannot come up to the conscious. It's not true. The id is not available to the conscious. So, we now have newer formulations of the Freudian concept. And these people we call them Udofia, and they are listed up to 17 of them or so. But we don't have to talk about it. Just to show you, there are many more people who are doing it. So, their conception of psychotherapy is a very simple one. I'll come to what I mean by trade. But that people, when they go to the level where the ego is like you are grown up, that what they're going to have is what we call psychic conflict or conscious. And the summary of it all is that when the superego is trying to suppress the id, then you have the original neurosis. The original neurosis is the suppression or repression into your conscious. That's the original. From there, everything starts. So, if you have the ego suppressing the id, then you have anxiety and obsessions. Whereas if you have the superego suppressing the ego, you have depression and guilt. You don't have time to do details. In order to get to the second part of this lecture, which I told you about, which is the structure, the psychic structure, you need to understand James' 4 stages of cognitive development. Because there are three formulations of these theories that are combined to get the 9 stages I'm going to show you the next slide. You have to understand the Piaget's, which if you read psychology, the way we did, we have time, we have 6 months, we didn't have to pass conference before coming to psychiatry. So we have time to read psychology. And that you can also do psychology by Atkinson and Atkinson is important. And that's why it says the pre-operational, complete mind, and the formal operational. And we don't have time to give the details, but please put this in mind because this is what is going to guide your life. So see now, those stages of Piaget, some of them are appearing here. What I'm showing you now is a new formulation of like what is this saying? As I said, this was drawn by vibrations. The drawing is there by this person, but they colored it, they put it in this way. So the green side are what we call the basic structures. I will explain. And those basic structures are, okay, the model is that the individuals that you are climbing the ladder. When you come to each stage of the ladder, that is a stage of life. Like in development, you have holding the head, sitting down, standing, walking, and talking. So those are basic structures of the nervous system, growth. But we're talking about basic structures of the mind growing. So you have the time where you have sensory-physical, which is similar to Piaget's emotion. Then fantastic emotional, that's emotional level. And number 3, we have the presentational mind. I want to explain that. See, we teach children, A is for apple. All those of us who raise children. That's all we do that. you don't, you have to do that at a stage. Why do you do that? Because you want to teach children how an image can be represented by a symbol. The image is an apple, but you want to teach the child that this apple can be represented in another way, which is a symbol, which is words. So when you see a word written apple, it is similar to apple. So this is that level. There is the apple. That's what I call this level. But you have another level still at the end of that representation, another representation. And that's another level where you call concept. So let's say a tree, you have the image of a tree, but there's a concept of a tree which is T-R-E-E. Sorry, and there is a, what do you call it again, symbol. But the concept of a tree is now more than the image you see. It has roots, stem, and all those type of things that which you know a tree. So that's a concept. In other words, there can be million types of trees. But for a child, at this stage, you have a tree, this is a tree. T is for tree. So you go to the next level, where the child can now start going to primary school, where they learn arithmetic. Always you learn arithmetic before algebra, which is much more abstract. This is the stage that the clinical psychologists